Prostate cancer is the most common cancer in men. 1 out of 6 men will be diagnosed with prostate cancer over the course of their lives. Some of these are slow growing, but many men will be diagnosed with a form of prostate cancer that's more aggressive and generally requires treatment with either surgery or radiation. To screen for prostate cancer, your doctor will check a blood test called a PSA and examine the prostate. This is done annually, usually starting around the age of 55, although in patients with identifiable risk factors, it may be started sooner. In patients with an abnormal prostate exam or an elevated PSA, the patient will generally be referred to a urologist where more of a workup can be done. BPH, which stands for benign prostatic hyperplasia, is one of the most common problems that we take care of in urology. As we age, our prostates get bigger, and that's just a fact of life for most men. In a lot of men, as the prostate grows, men will experience issues related to urination. This can manifest as a weakening of the urine stream, having to wait longer and longer for urine to start coming out, going to the bathroom more and more often, or even waking up at night several times to urinate. As it gets worse, a strong sense of urgency can develop, and that means when you got to go right now. You can't really wait. And it can even get to the point where you don't make it to the bathroom, start having an accident before you get there. A lot of guys will wait till the issue is really bothersome before coming to see me. Unfortunately, some of the changes that happen can be irreversible. The earlier you get seen, the sooner we can evaluate you and start medication to slow the process and hopefully reverse some of the changes. Urinary incontinence is an inability to control when the urine comes out. And there's many forms of urinary incontinence. The two most common kinds that we'll see are generally related to stress or urge. In women with stress incontinence, activities like coughing, sneezing, laughing, exercise, anything that increases pressure in the abdomen will cause some urine to come out. It's very common for women to experience this after they've had children. With urge incontinence, it has more to do with getting the urge to urinate, and then before you can make it to a bathroom, your bladder just starts emptying. It's probably the most common issue that we treat in women, and one of my biggest pet peeves is women being told leakage is just a part of life for women as they get older. And that's really frustrating because it's very easily treated, often with behavioral changes, and sometimes medications and surgery can be used, but it's not something that you should have to live with. It can be very socially isolating to leak, and there are many options that exist. So there are some behavioral things that can be done to help prevent urinary incontinence. Certain foods and beverages certainly can worsen urge incontinence. These are things like caffeine, alcohol, spicy food, chocolate, anything acidic like tomatoes or tomato-based foods, citrus, the list goes on and on. Also, in patients who are obese, weight loss can help. There have been studies that have shown that even just 10 or 15 pounds of weight loss can reduce the number of pads by 1 per day. Finally, when behavioral issues no longer work, there are medications or even procedures that can be performed to help resolve urinary incontinence.